contracts the corner of the mouth laterally and forms an insincere looking smile. Look for it when someone is suffering through an unfunny joke. Zygomaticus major. It's a big smiler here. Draws the corner of the mouth upward and laterally, with bilateral contraction, predominantly displaying the upper row of teeth, often associated with joy, pleasure, and laughter. When activated, the eye squinting orbicularis oculi, these muscles generate an authentic smile of enjoyment. However, without the oculi participation, the zygomaticus solo smile presents a false signal of enjoyment. You can tell if someone is really happy to see you or not. Zygomaticus minor is here. Located medial to the zygomaticus major, it elevates and protrudes the upper lip. These actions deepen the nasolabial furrow and puff out the top of the cheek. Depending on the circumstances, this facial gesture can produce expressions ranging from a smile to a grimace. Muscles of the nasal region. We have the levator, labii superioris, right here. That's pretty easy. The nasalis, which is this, and this, two parts. The transverse portion, and then the alar portion. Procerus here, small triangular muscle located on the forehead, involved with the eyebrows more than the nose. Wrinkles the skin of the nose, draws the skin between the eyebrows, creating the horizontal creases. Often acts in conjunction with the corrugator supercilii to produce expressions of concentration or perplexity. Muscles of the eyes, corrugator supercilii is the one he was just talking about. Called this muscle of difficulty. Was involved with anything demanding emotional, mental, or physical. Bilateral contraction can form vertical wrinkles between the eyebrows, creating a frown associated with anger, worry, or perplexion. Orbicularis oculi. The sphincter muscle surrounding the eyes, responsible for the closing of the eyelid. Inner fibers, involuntarily closing the eyelid during blinking and sleeping. Smiling with your eyes will engage the lateral portion of your oculi, but over time, the chronic contraction of this muscle will form crow's feet. So don't smile too much. Muscles of the scalp. Who's asking about the ear muscles? Here we go. So it's occipitofrontalis, frontalis, and occipitalis we talked about already. The auriculatus muscles here, anterior, superior, and posterior. Anybody not wiggle their ears? Anybody just not talent? Come on. No talent here? Come on. Wiggle your ears.
Never did as a kid, that's what it is.
Yeah, there's no moving my ears are wrong.
No wiggling of your ears.
My ears I have no reason to move.
All right, so we talked about the carotid artery, okay? Lies deep, mostly deep to the SEM. You can palpate that pretty easily. Superficial temporal artery, you usually get this one too. Don't press too hard with this one. I can get that
I
right
do
there.
that for a workout sometimes.
Yeah. Lay on a pillow, you can feel it sometimes.
Only little people out there looking.
Facial artery, I don't think we can palpate this one. So it comes right along the base of the mandible. Facial nerve, okay, so here's where we've got these branches. Let's look at page 272. Exits the cranium and emerges superficially just anterior to the mastoid process. As it passes beneath the parotid gland, which is right in front of your ear here. The nerve branches off and spreads across the face, scalp, and neck. Often 2 or more branches of facial nerve cross superficially across the zygomatic arch. When exploring the parotid gland, the masseter, or the zygomatic arch, be mindful of the facial nerve's presence. Static pressure on the nerve can cause irritation or inflammation or even induce nausea in your partner. So we talked a little bit about the Bell's palsy. Anybody seen that or experienced that before? Yeah. You get, your facial nerve gets impinged as it comes through, I think the mental foramen down here. And you get that paralysis. It's freaky.
Yeah, we nicknamed him Face.
It's really sweet of y'all.
Yeah, so like when we see him, like, hey Face.
Hopefully he's learned to laugh at that one. Vertebral artery, we will talk about this later this afternoon, most likely. Branches off the subclavian artery and supplies blood to the brain and spinal cord. Kind of important? Yeah. Sends through the neck through the transverse foramen of C6 to C1 before passing through the foramen magnum of the occiput. It is inaccessible, of course, but a vital structure can be aware when palpating and or passively moving the head or neck. Again, we will come back to discuss that later about the vertebral artery test. So the parotid gland and the submandibular gland, lots of glands through here again. Parotid right in front of the earlobe, superficial to the masseter, soft lumpy surface, parotid duct, spaghetti-sized tube extending anteriorly from the parotid gland, touching on the anterior edge of the masseter to funnel saliva to the mouth. Submandibular gland tucked underneath the base of the mandible, round shape, can be anterior to the angle of the mandible. So submandibular gland is going to be under here. Thyroid gland we already palpated for the most part. Lymph nodes, we talked about how you can palpate these. Sometimes they're very tender, swollen. You can find them occipital region at the mastoid, just a little bit posterior and inferior to the mastoid process. Obviously under the submandibular region, and then at the supraclavicular. I don't see that one as much as I see it underneath here being an issue. And our friend the brachial plexus. We talked about thoracic outlet syndrome and all the compromised neurovascular structures through this area here. Could be, again, a rib that's elevated. It could be tight muscles. It could be a bony protuberance that's something is impinging on these neurovascular structures here to create some type of distal shooting pain, numbness and tingling, loss of circulation, all kinds of different symptoms with these thoracic outlet syndrome. Anything else? Pretty much. We'll talk about the branches of the trigeminal and the facial nerve and everything this afternoon. And that is that. Any questions before we break for some lunch? Lots of stuff here, obviously. Yeah.
So with the muscles of the face,
Yeah.
do we just know where they are and what they do?
All you gotta do is know what they do.
Know what they do?
Yep. And you should be able to pick them out on a picture type of thing. But you don't have to know origins and insertions for those. Anything else? Low hyoid muscles. Again, just appreciate those. Know their action. That's all you gotta do with that. Everything else is fair game for OAI. Alright? Meet back at 1 o'clock. Have your 250 stuff ready.
I just read the first sentence. I read anything else. I said, okay. I said, what to do? What to do? What to do?
So I thought I heard.
Yeah. You ever heard that before?
No.
Yeah?
Never heard this
I can't remember I've heard it. I think it's by the Family Guy.
I think so, Jim. That's what Stewie said. I think.
Why are you checking your staples?